Imagine telling someone you're getting a brain upgrade. Sounds like science fiction, right? Yet, deep brain stimulation is turning this joke into a reality for many. Today, we're diving deep into the revolutionary world of deep brain stimulation, or DBS, a procedure that's changing lives by targeting the brain's most intricate networks. We'll explore what DBS is, how it works, and the groundbreaking impact it's having on patients with neurological disorders. Stay with us to uncover the science behind this cutting-edge technology and hear the compelling stories of those who've found a new lease on life. Discover why DBS might just be the future of treating some of the most challenging neurological conditions. Introduction to Deep Brain Stimulation. Deep Brain Stimulation, or DBS, is a transformative medical procedure that has evolved significantly since its inception. The journey of DBS began in the 1980s, when it was first introduced as a treatment for movement disorders. Its development marked a pivotal moment in neurosurgical treatments, offering a new lease on life for patients with conditions such as Parkinson's disease, essential tremor, and dystonia. Over the years, the application of DBS has expanded, exploring its potential in treating psychiatric disorders like obsessive-compulsive disorder and major depression, showcasing the versatility and potential of this technology. The essence of DBS lies in its ability to modulate brain activity with precision. The procedure involves the surgical implantation of electrodes in specific areas of the brain. These electrodes are connected to a pacemaker-like device, known as the impulse generator, which is placed under the skin in the chest. This device sends electrical impulses to the brain, targeting areas that control movement and mood. The electrical impulses can be adjusted to optimize treatment for each individual, making DBS a highly customizable and adaptable therapy. The science of DBS. At the core of deep brain stimulation is an intricate understanding of the brain's neurological framework. DBS operates on the principle that certain neurological conditions are the result of abnormal patterns of brain activity. By delivering targeted electrical stimulation to specific brain regions, DBS can modulate the activity of neural circuits that are involved in these conditions. This modulation can result in significant improvement in symptoms for many patients. The neurological basis of DBS is grounded in decades of research into the brain's functioning and its role in movement and mood disorders. Studies published in journals such as the New England Journal of Medicine have detailed how DBS influences the brain circuits and neurotransmitters. These studies reveal that DBS can alter the signaling pathways in the brain, effectively resetting abnormal neural activity to more normal patterns. For instance, in Parkinson's disease, DBS targets the subthalamic nucleus or the globus pallidus interna, regions involved in motor control. The stimulation of these areas can help to alleviate symptoms such as tremors, rigidity, and bradykinesia. Moreover, the impact of DBS on neurotransmitters further elucidates its therapeutic effects. Neurotransmitters are chemical messengers that transmit signals across the brain and are crucial in regulating mood, movement, and cognition. DBS has been shown to influence the levels of various neurotransmitters, including dopamine, which is significantly depleted in Parkinson's disease. By modulating the release of dopamine and other neurotransmitters, DBS can improve the neurological function and quality of life for patients. Candidates for DBS surgery. Selecting candidates for deep brain stimulation, or DBS surgery, involves a meticulous evaluation process aimed at identifying individuals who are most likely to benefit from this intervention. The primary conditions treated with DBS include Parkinson's disease, essential tremor, dystonia, and in some cases, major depression and obsessive-compulsive disorder, or OCD. Each of these conditions has its own set of criteria for DBS candidacy, generally revolving around the severity of symptoms, the patient's overall health, and the response to conventional treatments. Parkinson's disease patients, for example, are often considered for DBS when medications no longer control symptoms effectively or cause severe side effects. Essential tremor candidates may turn to DBS when tremors become disabling and significantly impair daily activities. For dystonia, DBS is considered when the condition is refractory to medical therapy. In the realm of psychiatric disorders like major depression and OCD, DBS is explored as a last resort after exhaustive attempts with traditional therapies have failed. The pre-surgical evaluation process for DBS candidates is comprehensive, ensuring that the surgery is both safe and likely to be effective. This process includes neurological assessments to confirm the diagnosis and gauge the severity of symptoms. Neuroimaging studies such as MRI and CT scans are conducted to identify the precise brain targets for electrode placement. Psychological evaluations are also crucial, especially for patients with psychiatric conditions, to assess mental health status and readiness for surgery. Additionally, a multidisciplinary team involving neurologists, neurosurgeons, psychiatrists, and other healthcare professionals collaborates to review each case, ensuring a holistic approach to patient care. The DBS procedure. Deep Brain Stimulation, or DBS surgery, is a complex, multi-stage process designed to deliver targeted electrical stimulation to areas of the brain involved in motor function, mood regulation, or both. The procedure is broadly divided into pre-operative preparations, the surgical procedure itself, and post-operative recovery and management. Pre-operative preparations. The journey towards DBS surgery begins with comprehensive pre-operative preparations. Patients undergo a series of evaluations, including neurological assessments to map the specific brain areas responsible for their symptoms. Advanced imaging techniques such as magnetic resonance imaging, or MRI, or computed tomography, or CT scans, are employed to create detailed maps of the patient's brain. These maps are crucial for planning the surgical approach and for the precise placement of electrodes. Additionally, patients might engage in discussions with a multidisciplinary team, including neurologists, neurosurgeons, and psychiatrists, to fully understand the procedure, its benefits, and potential risks. The surgical procedure. DBS surgery is typically performed in 2 stages. The first stage involves the implantation of electrodes into the brain. Patients are usually awake during this part of the surgery to provide real-time feedback, which helps in the accurate positioning of the electrodes. Local anesthesia is applied to the scalp, and a small hole is drilled through the skull to allow for electrode insertion. Real-time neuroimaging techniques, such as intraoperative MRI, guide the surgeon in placing the electrodes in the predetermined brain regions. The second stage, often performed on a different day, involves implanting the impulse generator, a pacemaker-like device, under the skin in the chest. The electrodes previously placed in the brain are connected to this device through subcutaneous wires, running down from the head to the chest. This device will send electrical impulses to the brain to modulate neural activity. The second stage is usually performed under general anesthesia. Post-operative recovery. Following surgery, patients typically spend a few days in the hospital to begin the recovery process. The impulse generator is usually activated a few weeks after surgery, allowing time for healing. Post-operative care includes regular follow-ups to adjust the settings of the impulse generator for optimal symptom control and to monitor for any complications. Rehabilitation services such as physical therapy, occupational therapy, or speech therapy may be recommended to maximize the benefits of the surgery. Risks and considerations. While DBS surgery is generally safe, it carries the risks inherent to any surgical procedure. Potential complications include infection, bleeding in the brain, stroke, and issues related to the hardware, such as lead misplacement or device malfunction. Psychological effects, including changes in mood or cognition, have also been reported. A study published in the Journal of Neurology, Neurosurgery, and Psychiatry highlights the importance of careful patient selection and post-operative management to minimize risks. Management of complications involves a combination of medical treatment, surgical intervention if necessary, and close monitoring. The multidisciplinary team plays a crucial role in identifying and addressing any issues promptly, ensuring the patient's safety and effectiveness of the therapy. Challenges and controversies. Despite its benefits, DBS faces several challenges and controversies. One common misconception about DBS is that it is a cure for neurological and psychiatric conditions. It is important to clarify that DBS does not cure these disorders, but rather alleviates symptoms, improving quality of life. Patients and their families must have realistic expectations about the outcomes of DBS surgery. Ethical concerns also arise with DBS, particularly regarding its use in psychiatric conditions. Questions about patient autonomy, the risk of personality changes, and the potential for coercion must be addressed. The ethical implications of altering brain function in individuals with psychiatric disorders necessitates careful consideration and informed consent processes that are thorough and transparent. The cost of DBS and accessibility issues represent significant barriers to treatment for many patients. DBS surgery and the associated pre- and post-operative care can be prohibitively expensive, often exceeding hundreds of thousands of dollars. Insurance coverage varies widely, and not all patients have access to insurance plans that adequately cover the costs of DBS. This financial burden limits the availability of DBS to a broader patient population, raising concerns about equity in healthcare access. Deep brain stimulation represents a beacon of hope for those suffering from debilitating neurological conditions, offering a chance at improved quality of life through advanced technology. As we stand on the brink of new discoveries, the journey of DBS is just beginning. Who knows what the next chapter will hold?